So let's take a look at the latest. For this week's COVID-19 update, we have yours truly, Dr. Brian Harrington. Dr. Harrington, how are you doing this morning?
I'm well, thanks, Eric. Good to see you this morning.
It's good to see you as well. Our numbers have kind of been going up. Can you talk to me about this?
Oh, we can talk about kind of for sure. Our last 2 weeks, we had the highest 2 week tally that we've had so far in this pandemic. We had a total of 37 cases, and we may still get a few more trickling in from this past week. We had 21 2 weeks ago. Last week, or as of yesterday, we had 16 extra. So I would say that we, reached a new higher level, and we're kind of still there. I guess it's good that our count was a little bit lower, but as I said, we may get a few more there. This represents, this wave that we started in September, presumably related to Labor Day in part, but we've never really gotten off that wave. And so our numbers are higher than we're used to, and they're not going down.
Speaking of going down, Casey's Pond numbers have been going down. Where are they at now?
Yeah, so while our total numbers would present a more of a concerning note, the good news is a couple weeks ago we had a total of 5 staff over at one of the sections in Casey's Pond who were positive, and we are now beyond the 2 week mark, and we've had no further positive tests. So when we have an outbreak, or in this case, it wasn't considered a resident outbreak, but when we have cases at these long-term care facilities, then we test everybody every week. And in this situation, we didn't find any other positive cases. So that's great news. I think that speaks well to Casey's Pond staff, because these infections, they come from outside the walls of Casey's Pond. It's hard for people to necessarily avoid them sometimes in our community. And so the staff pick it up, they get detected, and their measures at Casey's Pond, though, appear to be effective. They kept it from spreading to any of their residents who are vulnerable. And so I applaud them. I think their measures that they've adopted over the course of this pandemic are paying off in terms of reducing the risk of transmission to their residents.
Yeah, let's do it the Casey Pond way. I think they're a great representation of how you nip it in the bud. I love it.
Yeah, and all of our long-term care facilities in the county and around the area, they've learned a lot. And I think those measures are paying off. And so this is the first time that we have seen cases at one of our long-term care facilities that did not then translate into infected residents. So that's great news.
That's great news. And
Great news.
Congratulations, Casey's
We have
Pond.
we have too much disease in our community, though, and that's what, it comes from the community. So as long as we see high numbers in our community, our vulnerable populations remain at extra risk.
Speaking of numbers in our community, we've had 2 high school students test positive. Would you care to talk about that?
Yes. So, previous to this, we had a middle school student test positive. We had an elementary school student test positive. In both of those situations, that was the only case we detected. In this situation, we had a high school student now getting close to a couple of weeks ago who tested positive. That student's cohort, class grouping, was placed in quarantine, and one of those individuals who has been on quarantine subsequently did test positive. We do not say for sure that was a transmission between those 2 individuals. They both could have even acquired the infection outside of it. But technically, because it involves 2 individuals from different households in a class cohort within 14 days, that is the definition of a class outbreak. But our high school here implemented many things to begin the school year for exactly this kind of situation. So by having formed cohort groups, they've limited the contact. So we don't have to shut down the whole school. We can do targeted quarantines as we have in this case. And we haven't seen any other cases yet. I would summarize these school situations by commenting that the schools have a lot of measures in place to reduce spread within their walls. I believe that the greatest risk to the schools actually comes from our community right now. And so even though we have these 2 cases, that's all we have found related with this one instance, and they'll actually both be done here in a few more days.
That's great. And, we love to hear a story. You've mentioned this to me before on air. We love to have a story behind each COVID case, because then we can trace it back and contact tracing and identify it and stop it. But apparently, in the past couple weeks, we've had a few cases where that wasn't the case.
Yes, we continue to have several individuals, this past week, 5 or 6, who we didn't have a good story for. And so we assume in that case, it's this term community spread, meaning they did pick it up somewhere. We just don't know. To have that going on or to have that happen, you assume that the incidence of disease in your community is high enough. So that's why it's a bad sign when you have people we don't have a story. And usually we have some individuals we can't figure out where they got it. But we always want to keep an eye on that and hope that those numbers of unexplained infections stay low. Many of our infections tend to be contacts, and we find it that way, or family members. So a family member is positive, then we test other family members and they're positive too, and so forth. But those cases where we can't find a story do represent kind of the prevalence of disease in our community. This is cliche, it sounds old, but the caution fatigue is real. Everybody's tired of the cautions about COVID-19, but darn it, we've got to stick with it. As we've just discussed, we've had a couple weeks of higher cases. Where's that going to go? Is it going to keep going up? Is it going to go down? And then these higher case counts, they have correlation. We see hospital admissions. We've seen that here in the last month or more. With this current wave, we've had a couple people to the local hospital. We see more people ill. We see more complications. So we've got to get a handle on this. We don't want this to go up, and it also will have impact for our businesses. You and I didn't get into this a lot, but there's the levels of where we are in the safer at home metric, the dial will. And so our current case count has moved us on paper back to the level 2 area. And if we don't move out of this case count level by next week or so, then we may get moved from level 1 to level 2, which therefore has some added restrictions for business sizes and activities and things like that. I wouldn't say that it's shutting things down. It's just as our case counts remain higher, we will be having to back off on some of our group sizes and other activities that we see currently going on in the community.
Yeah, and I know that it's hard for restaurants right now too, because as we're moving and transitioning into colder weather, uh,
Yeah.
the seats are even more limited. So it's really creating a challenge for some of these local restaurants here.
Yeah. And they're working, they're trying to figure out how to make it happen with outdoor heaters and other ways, and certainly the takeout world. But I don't want to just, necessarily focus on restaurants. It has to do with things like how many people work in your office. We have to still remember that those recommendations continue. That if you have a bunch of people working in a confined space in office, that's transmission risk, and we see examples of that. So, people need to, for the time being, still try to work at home if possible and limit the number of employees that you have congregating at one time. Things like that. We've not identified one singular activity, business arena, anything where we can say that this is really having the most impact on our community transmission. It's a lot of things. And so, we pick the thing that you can impact on and make a difference in your local world and trying to reduce the risk of transmission.
Great. Well, Dr. Harrington, thank you so much for joining me on air this morning. I appreciate you.
Yep. Happy Halloween, everybody.
So it's a scary time because of Halloween, but it doesn't need to be a scary time because of COVID. What you need to do is just follow the same guidelines you've been following all along. Wash your hands, cover your cough, social distance, and stay safe, Steamboat. We have more show coming to you right after this.